Great and mighty, you reign. Jesus, Jesus. Come on, somebody lift it up. There is nothing you cannot change. Nothing you cannot turn around. You are able, great and mighty. I put my trust in you, for you are able. Say, Jesus. But there is nothing you cannot do. I so will sing to you. Great and mighty, you reign. Jesus. Lift your voice, sing to your our God, King of all, the strong and breathless, eternal King, Jesus. Oh, there is nothing.
We're listening to Hope 103.1 FM. Keep it locked.
You didn't come for the strong, you're here for the broken. This is my song, I'm in the session, God. Only you know. Only you know how it feels inside. This pain when you try to hide it. Afraid to cry for help, you smile and drown it out. Only you know how it feels inside. To try and try and try and try and try and fail. Only you know why you say the clock and he's not home. Out with his boys drinking, 'cause he knows when he goes home and opens that door, it's another night of fighting or silence. Oh, she's cutting up deep, and they just think that she's crazy, but you know better, doc. You know she's being touched in the wrong way. Oh, doctor, can you heal him? I pray, 'cause if you don't, he will not make it. Doctor, can you heal her? I pray, 'cause if you don't, she won't make it till the morning. Doctor, can you heal them? I pray, 'cause if you don't, they will not make it. Doctor, can you heal them? I pray, 'cause if you don't, they won't see the morning. Oh, 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 oh. Only you know how she feels inside. These feelings she's trying to hide, that's for another girl. It's not supposed to be. Only you know she prayed and prayed, how much she is afraid to get the help she needs, that your blood can set her free. Oh, only you know he's going to church but losing hope, 'cause he's tired of repenting for the same things over and over. It's almost over for him. Only you know I'm surrounded by broken people, and they need a hero 'cause they can't fix what's wrong on the inside. Your boy's here to see them. Doctor, can you heal her? I pray, 'cause if you don't, she's not gonna make it. Doctor, can you heal her? I pray, yeah.
A pleasant good evening to one and all. Again, I would like to welcome you to Heavenly Medicine. Okay, guys, so this is episode 7. Okay, so good evening to all our friends, our family. Good evening to all the persons that are locked in on 103.1 FM. You are listening to Heavenly Medicine, and I am your host, Dr. Zayniah Louison. Okay, so on today's episode, our title is What is PCOS? All right, guys, I'm just saying thank you for all those of you that are locked in, that are tuned in again, whether you are on YouTube, Facebook, or even listening to us on the radio. I just want to say a pleasant good evening to you and thank you for listening to Heavenly Medicine. All right, so I'm just asking all our friends, our families, everybody that is there locked on, don't be afraid. Send in your messages. Okay, you can even call on our number. It's 403-1031. Okay, you can send your WhatsApp messages or you can directly message us via YouTube or Facebook. Okay, so we just want to go right in it. Okay, guys, so what is PCOS? All right, so I'm waiting on you guys. Don't be shy. We're waiting for persons to call in. You can even tell us a little bit more of what do you know about it. I'm just going to give you like a quick little trivia this evening. So I'm not going to give too much information as yet. I'm allowing you to come on. All right, come on board and just tell us what you think PCOS is. Okay, if you know anybody, persons, family members, or anybody that might be experiencing this condition and you would like to give a little bit of info about it, please feel free. Okay, hi, Pansy Hostin. Okay, thank you. A pleasant good evening to you. All right, so those of you that would like to call, you can call in and you can just tell us a little bit more. Okay, we may have a winner. It might be a trivia this evening. So who is willing to share with us? We're waiting. Okay, so PCOS. So I'm giving our callers at least 10 minutes. Okay, we have Miss Sabazan. All right. So we have somebody. We have Chantalie Worm. Oh, hi, Chantalie. Okay, so she has PCOS, is polycystic ovarian syndrome. Nice. We have Miss Sabazan. She said it's polycystic ovarian syndrome. Anybody else had something else? Okay, so we're waiting on some other folks to message in and tell us what they think PCOS is and what they think we're talking about today. Even if you would like to call, you can also call in again. Our number is 403-1031. So you can call on the radio station again, guys. It's Hope of FM 103.1. Okay, you can call in and you can also let us know what is PCOS. We're also waiting. So we have two lovely ladies that are somewhat close. I don't want to drop the ball as yet, so I'm giving others a chance. Okay, so while we wait, we're going to have a little drum roll. Can anybody, those of our listeners and viewers, would like to share with us as to what PCOS is? Okay, so first of all, I'm just going to give Ms. Sabazan, that is correct. PCOS is polycystic ovarian syndrome. Chantal, I hope I'm pronouncing your name correctly. You are correct. PCOS is polycystic ovarian syndrome. And that is exactly what we are going to be discussing on this evening's show. Again, I'm waiting for our viewers to share with us a little bit more as to what they know about PCOS. What have they heard? Do you know any family member, friend, or any person that you think might be experiencing this condition? And what are some of the things that they experience and setbacks? We'll love to hear from you. So we're waiting again, guys. We're waiting to hear. We're waiting to read your messages. Please feel free as we discuss PCOS, known as polycystic ovarian syndrome. Before we get into it, if another person can message and let us know another name for PCOS, you will be one of our lucky winners this evening. There is another name that is known for PCOS. So you have 10 seconds to message in. We are waiting to hear from you. Another name for PCOS. So just another clue. Okay, so PCOS is one of the most, what we will call endocrinopathies. It is one of the most common endocrinopathies among women. So there's another name for PCOS. So we would, again, guys, we're waiting on you. We just want to hear that from that lucky person. that's going to win something from Heavenly Medicine if you're able to tell us the other name for PCOS. So you have 10 seconds to call in. The number again is 403-1031, or you can WhatsApp us again at that same number, or you can message via YouTube or Facebook. Okay, so I guess not anybody really wants to get that gift this evening. Okay, so we're just going to jump right in. So for those that didn't know, I would like to share this with you. Another name for PCOS is called Stein, it's Stein, Leventhal syndrome. Okay, so as the lady said earlier, it's actually polycystic ovarian syndrome. Now, when we say the word poly, we mean many, right? Poly, right? It's cystic, so it's a lot of cells, like cystic looking like cyst looking cells, or cystic structures, cysts on the ovary. And ovarian, we're dealing with our ovary. So today's topic is, yes, a female is pertaining to the female reproductive system, but it's also a topic that both our females and men also needs to be well educated about. So I'm just going to dive right in a little bit with the information as to what PCOS is. Now, commonly you would hear many people speaking about or referring to polycystic ovarian syndrome as PCOS. Now, some people would have been, oh, I always heard about this term, but I never really knew what it is. Okay, so today we'd like to educate you guys a little bit more about polycystic ovarian syndrome. So basically, as I mentioned earlier, it is one of the most common endocrinopathies, all right? So it's a hypothalamic, we're dealing with the hypothalamus, pituitary disease that results in enlarged polycystic ovaries and chronic and ovulation, which leads to elevated estrogen and androgen production and atypical follicle development. So I'm just going to narrow that down, break it down a little bit, and simplify it for everyone. So we're talking about a condition which affects, first of all, it's hormonal. Okay, nice. Okay, Harissa Batiste, yes, it's polycystic ovary disease. Right, so we have polycystic ovary disease and polycystic ovarian syndrome. So they are hand in hand, yes, correct. Okay, all right. So now we're talking about starting from the brain, where our hypothalamus is, and our pituitary. Okay, we're also including organs such as the adrenal glands, and we're also including our ovaries. All right, so when we talk about estrogen, we're talking about, this is our female hormones. Many of us would have heard of the term estrogen, also androgens as well. These are also produced by the actual ovary, right? But as a result, now instead of making our normal follicle, what happens is that in the case of PCOS, there are many follicles that are actually produced. So, for instance, let's go back to basics. So, in the average menstrual cycle, at the day 21, we have what we will call an actual mature follicle. Okay? And this follicle would then release the actual egg. All right, and this will be ovulation. Now, in PCOS, we have a condition called anovulation, meaning there is no ovulation because there is no actual maturity of that one main mature Graafian follicle. There are many follicles or cysts that has not matured well enough to release that egg or ovum. So I'm going to show you eventually some diagrams and pictures, and we're going to get all into it, but I would like us to actually have a clear idea as to what PCOS really is. So it's very hormonal. Okay, so now we're going to look into the pathogenesis. So all of this is basically the science, the medicine behind it all. Now, it is actually what they will say poorly understood. The etiology is actually not fully known, right? It is thought that high amplitudes of this hormone that is called GnRH pulses that causes an increased pituitary LH release. And what happens as LH, which is a hormone, again, is released from the pituitary, this then causes the our ovaries to actually release high concentrations of androgens. Okay, so I can always break this down. So from the pituitary, there is LH that is secreted from the pituitary. Now, this LH will then stimulate our ovaries to produce what we will call androgens. Now, these androgens are commonly known to be testosterone, but we're going to get into that. All right. So now the main thing, what happens is that our actual cell, right, the ovum, there are cells around it that are called T-ca cells. And these T-ca cells are the ones that would actually secrete these androgens. There is also, in this case, an increase in androgen aromatization, where these androgens, whether it's DHEA, they then are converted, right? So they are converted into either DHT. And we're going to get further into these conversions because that's where we will find women that are experiencing PCOS to have presentations such as hair under the chin. They would have certain types of male pattern baldness and certain things that are more masculine, or what we will call virilization. Okay. All right. So another thing I like to get into further is obesity and the whole issue of obesity, and as a result of this increased estrogen, and that also aids in further making PCOS worse. Okay. All right. So basically, in patients with PCOS, the ovaries really are hypersensitive to insulin. Now, last episode, we discussed diabetes type 2. Now, one of the things that we will find in PCOS will be persons that have what we call insulin resistance. Now, the insulin actually stimulates the ovarian T-ca cells to secrete androgens further. So what we actually see that it is the pituitary that is releasing these hormones that is then stimulating our ovaries. The ovaries then is releasing this androgen, and this androgen then can be either converted to estrogen in the adipose tissues and then converted into DHEA, where we have these different types of male masculinization features, right? Then we also have persons with PCOS that has what we call insulin resistance. So most times they are at an increased risk of diabetes type 2. Now, when you have this insulin resistance, your chances are, again, what happens is that your body, insulin does not work well with the tissues. It's resistant to it. So as much as the pancreas is going to secrete this insulin they're not working well. It's resistant. So you would have an increased concentration of insulin in your blood. Now, what happens is that this insulin goes and it stimulates the ovaries. And as a result, as it stimulates the ovaries, more and more androgens are actually released. And this also will inhibit the liver from producing certain hormones to remove some of these excessive androgens in the body. And this insulin, with all of this androgens, increases the condition and increases this androgen again in our body, causing masculinization, causing amenorrhea, where there are no period or no menses at all, and also obesity. Okay. All right. So I just want to mention it can be a little bit difficult in understanding some of the terms and some of the hormones, but the most important thing to know is that it results actually in free androgens. And when we think of androgens, guys, most times you think of testosterone, right? And androgens should be most of a masculine hormone, but we also, from our ovaries, androgens are actually produced. Again, I just want to give you a little science behind it. The androgens are converted where we have the DHEA. It's then converted to testosterones. Then the testosterones are then converted to DHT, which is a hormone that actually increases your chances of what we will get into today called hirsutism. And that's where you would find hair under the chin. We would find certain male pattern growth around our skin or so as females, which is not a normal presentation. Again, I would like persons to call in. If you know anything about PCOS that you would like to share with us, please feel free. Okay, if there's anything that you yourself could have had experience and these were the things or therapy that was used for you and it has improved, we would love to hear from you. Our number again is 403-1031. So you can WhatsApp us or you can message us on YouTube or Facebook. All right. So I'm just going to go a little bit more into it as to some of the classic presentations of PCOS. So PCOS mainly is seen in what we will say an overweight female or an overweight young female, young woman, or one that might be obese. Now, one may ask, what is overweight? How can I determine whether I am overweight? The truth is, guys, sometimes we are actually overweight, but in our era today in society, it's actually seen nice, like that you're thick, and it's actually nice, but the truth is we usually would measure our BMI, and this has to do with our weight and our height. So pretty much a BMI that is less than or equal to 30 usually would be someone that is not overweight. An overweight person would definitely be someone that would have a BMI that is greater than or equal to 30. So sometimes most of us that are African American or Afro-Caribbean, we really do have more robust features, more healthy, more, thick looking. So some of us, to be honest, we do fall within that category of overweight or sometimes fall within that category of being obese, unfortunately. So most of us would definitely have to pay more attention in controlling our weight. So that is what they're mentioning really when they say you're overweight or in that you're usually within that category. Okay. So usually persons like that would present with what we call oligomenorrhea. So there's a lot of big terms today. And if you would like to send in, come on guys, you send in your messages. Let us know what oligomenorrhea is. Teach one. Okay, teach one. Tell us what you think oligomenorrhea is. Okay. All right. If you know what menorrhea is, feel free to message and send you can even call as well. We're excited to hear from you. So I'm just going to jump right in. So oligomenorrhea is usually something what we will say is irregular menstruation. Right? Just to be specific, it is actually less than 9 menstrual cycles within a year. Okay, so sometimes we find persons that are suffering with PCOS will have this type of classic presentation. Hirsutism. Now, hirsutism is the male growth of hair under the chin, sometimes above the lips. They become very hairy. These are what we call hirsutism. And as mentioned earlier, this has to do with the androgens. Okay, androgens. All right. Then virilism. Now, this is a very, it's an uncommon term, but as a result of this increased androgen, what we find is that sometimes even in the reproductive organ, it starts to become more masculine. Okay. Another thing we see also infertility. All right. And I know many of us, we want to get into that. So also infertility is also one of the most important clinical manifestations that you will also see. Acne. All right. Acne is very common. And on top of it all, most of these young women will have a greater risk of having type 2 diabetes or let's say insulin resistance. Now, insulin resistance is actually seen in more than 50 to 70% of women with PCOS. So most times, a young woman that has PCOS, whether it's been diagnosed at age 21 or so, chances are it's linked with insulin resistance, where she would actually have an elevated HbA1c. Okay. All right. So we have a question from Chantal Worm. Does this mean you can't get pregnant? Okay. So I don't want to say that you can't get pregnant when it pertains to PCOS, but your chances of getting pregnant is a little lower than someone who does not have PCOS, because PCOS at the end of the day does present with what we call infertility. So as we get further into the topic, we're going to learn a little bit more as to why we would say there's infertility. So remember when we mentioned earlier that it presents with what we call anovulation. Now, this means there is no ovulation. Your body is not allowing you to ovulate. Why? Because normally, as we learn, we have our menstrual cycle. There is that mature Graafian follicle that would then burst, or we say rupture, and it releases that ovum or that mature egg, right? Now, in the event of PCOS, there is no mature Graafian follicle here. There's just many cysts that is just being developed. And what is so important is that we need this main hormone that is secreted from the pituitary as well. And this is FSH. It's called follicle stimulating hormone. Now, if this FSH is not being secreted properly and it's not stimulating our ovaries, then the actual granulosa cells that is nicely surrounding our ovum, it does not grow well and it does not mature our actual eggs properly. So what we find is that there's just many cysts, abnormal follicular growth. So there's no mature follicle that is going to release that healthy egg. So that is where we would have this condition of an anovulation, no ovulation. So we have a question here. Is PCOS associated with painful period? There is a possibility, yes, it does. Now, different folks may have different symptoms, but it does somewhat. Now, we'll get a little further into it, but the reason why you would have such a painful period in such case, there are some women that will tell you they have no period at all, which we say amenorrhea, right? And anominorrhea, there's actually no period at all. Whereas some women, when they do have the period, now remember there is going to be different cysts. There's many follicles on that. And what happens, even though one tries to rupture, as it ruptures, it causes irritation around the smooth muscles, right? And it's called metal shems, right? Where you get that type of pain and a lot of type of irritation due to the irritation around the smooth muscles. And it also may sometimes secrete certain types of fluid around that area. So you will get certain pain, a lot of hip pelvic pain. And yes, it can lead to painful periods. That is correct. It is possible for someone with PCOS to still see their period every month. There is a possibility that can happen as well. Now, there's, as I said, many times persons who actually was diagnosed with PCOS, sometimes it could have been just they had maybe missed their period maybe for 3 months and was sent by the physician to do an ultrasound. And there they would have seen, okay, you actually have what we will say more than 12 follicles or cysts present on the ovaries, and it can be bilateral on both ovaries. So as a result, the doctor would say to you, okay, now, so this is a diagnosis. This is actually PCOS. But many times you could have been having your periods normally. Now, another thing, PCOS is very hormonal. Most persons that would have been diagnosed with PCOS either would have been at a very young age. Now, some women, even though they may not have known that they had PCOS, there would have been certain things, as I mentioned earlier, that would have either prompt them to see their gynecologist or their physician. Is either a mist in the period or either the male pattern growth, hair growth on their faces. It could have been the acne, the weight gain, and it's very hard to get rid of. Some people have what they call the darkening around the neck, and that is definitely a sign, or the darkening under the arms, which is definitely a sign of insulin resistance. So some of the things might prompt them to actually see their physician, where they might actually do just a general blood workup, and as a result, the HbA1c might be elevated. And your physician might ask certain questions like, okay, how old are you? For instance, if you're at a stage where you would like to have a kid or a child and you are not pregnant, they would ask, all right, so have you tried, or you and your partner trying, yes or no? Now, if there's, and that would definitely lead to questioning along the line of PCOS. Okay, so there's a question, can surgery help this? No, PCOS, the first line of a treatment will not be surgery at all. Because at the end of the day, when it comes to a young woman, we definitely know she would want to preserve, most young women will want to preserve their eggs. They want to make sure that what can happen to either help somewhat produce healthier eggs in their body. So that is the first line we will deal with. We want to look at how do we prevent PCOS or the onset of PCOS. So surgery will definitely be the last resort in the case that there are many cysts, and these cysts are complex cysts and they're causing a lot of problems. Right, then we will have that conversation as pertaining to surgery. Okay, so I'm just going to move on a little bit because I definitely want us to understand in terms of type 2 diabetes, because it's very common among women with PCOS. Now, someone asked a question a while ago. Sometimes while actually in your physician office, while a physical examination is being done, now this is somewhat common where during the actual examination, some women would tell you that they actually felt some type of pain around the actual pelvic area where your ovaries are actually located. So this is what we will call a bilateral ovarian enlargement. It's actually like have a little hump, right? And that is to show you that both ovaries, right, actually have these large cysts of follicles present there, right? And this would also be a positive sign for women with PCOS. So menstrual dysfunction is due to PCOS, and it definitely manifests, as we mentioned earlier, as amenorrhea. Now, amenorrhea is actually having no period at all. Now, I remember some young persons, like within the age of like 16 and 18, if this happened to them, they actually were really happy about it, because in their minds it's like, well, I don't mind not having my period, right? Not understanding that it does have consequences, right? So at the end of the day, even though you are not having period at the age of 16 or your mens at 18, it is very important to see your general practitioner or a gynecologist, so you can definitely do a general workup. Now we're going to discuss a little bit more as to what are some of the things you need to do when doing a general workup. Right, but I just want us to get into some of the menstrual dysfunctions that you will see with polycystic ovarian syndrome. So we have, again, oligomenorrhea. We mentioned oligomenorrhea is irregular cycles. We also mentioned breakthrough bleeding, like we just had a viewer that just mentioned that you can actually sometimes have your period, right, or it stops. You no see period again. There's no period, no mens. And then out of the blue, there is bleeding. Okay, so all of these are a part of the menstrual dysfunction, what that we see in PCOS. So we have an actual criteria that I usually would work with, and it's called the Rotterdam criteria for the diagnosis of PCOS. So it actually requires the presence of 2 out of 3 of the following. So we're mentioning 2 out of the 3 would be a diagnosis for PCOS. So we're looking at oligomenorrhea. Again, remember guys, these are less than 9 menstrual cycles within a year. Hyperandrogenism. So this is whether there's going to be the hirsutism, acne, all of these things that androgen actually will cause. Then the polycystic ovaries, that is on ultrasound. So I'd just quickly like to get into a little presentation here for you guys. So before I even move further, I just would like you to have a look as to what it's going to look like. Okay. All right. So this is just an ultrasound image as to someone that would have PCOS, what it's actually going to look like. So sometimes you can find 9 follicles, sometimes you can find as many as 12 follicles, and all of these are cysts. They're cystic-like, so you're going to see that dark circle right there, and all of these are present on the ovaries, and most of the time they are bilateral. Okay, so I'm just going to leave this up so you guys can view it. All right, just in case you wanted to know what it actually looks like. So this is what's going to give you that definitive diagnosis that yes, you do have PCOS. All right. So now as pertaining to laboratory findings. So there's something that it is very important to do. It's called an LH FSH ratio. Now, not many labs would have that exact test, but it's very important for us to be able to do this test. So remember I mentioned that FSH is a very important hormone that helps with the proper development of that Graafian follicle. So if, for instance, and remember with PCOS, we have this increased surge of LH, which is called luteinizing hormone, right? And this LH then causes the adrenals to secrete these DHEA, which are like androgens, right? And then these androgens, then they can be converted to estrogen, and all of that estrogen is then going to either make matters worse by increasing adipose tissues and all of that we don't need, right? And some can be converted to DHI or DIT, okay, DHIT, and these are going to cause what we call that male pattern hirsutism, okay? So a very important test to take with what we will call an LH FSH ratio. Now, if this ratio is greater than 2, this is showing a positive sign of PCOS. Now, if you do an hormone panel, now many of us would be like, okay, well, I could just do a hormone panel. I want to check my estrogen. I want to check my just everything, right? Your progesterone. No, this doesn't really tell. There are some important tests that you would like to do, and it's the DHEA. Now, if your DHEA is also elevated, that's also a positive sign of PCOS. If your androgens are elevated, that's also a positive sign for PCOS. So it's also important, along with your ultrasound, it is also important to do those hormonal tests, especially, as mentioned, your LH and FSH ratio. So that would definitely be able to clue you in as to whether you have PCOS or not. All right. So as mentioned before, just to solidify, you definitely will see on ultrasound an enlarged ovary with 12 or more follicles per ovary. Now, complications of PCOS. So now, if we think of the anatomy, we have our uterus. If we're not shedding monthly, what happens is that you would end up having just an increase. Remember, what we actually shed during a menstrual cycle will be actually the endometrial lining, which we call the endometrium. Now, if we do not have a cycle after the release of that follicle, now when that follicle releases, that egg is released, then is either the body waits, okay, because remember the whole goal is for fertilization. Now, if there's no fertilization, then okay, that ovum is then what we say involuted, right? It's disintegrated, it breaks down, and then we continue with another cycle where there is shedding of the endometrial walls, right? Now, if there is no mature follicle and there's no ovulation, what happens is that our endometrium continues either growing or just at a steady state. So it's just there. Now, what happens as a result of that, there is an increased risk of endometrial cancer because it's not shedding at all. So what happens, some women, when they do an ultrasound, the actual lining of the endometrium is actually a little bit increased, more than it should. And then this would lead to further testing, and it may be a little bit worrisome in terms of the endometrium, what we will say endometrial hyperplasia, thickening of the endometrium. And that is of some concern, especially based on your age, right? So definitely there is an increased risk of endometrial cancer. Again, as our viewer just asked, yes, infertility due to that anovulation. Because if you do not have a fertile, if you do not have a mature Graafian follicle to release that mature ovum, definitely you would not have an egg to be fertilized. So it does increase the risk of fertility. All right. Also, this increases the risk of type 2 diabetes, right? So remember, due to that increased insulin and that insulin resistance, we eventually would then lead to type 2 diabetes as the pancreas continues to release insulin upon insulin upon insulin and the body will not respond. Then it definitely leads us to type 2 diabetes with an elevated HbA1c. Also, as a result of all these cysts, abnormal cysts on the ovaries, what we will find that there is an increased risk of a condition called ovarian torsion, and this is due to the enlarged ovaries, right? Another thing, again, due to that insulin resistance, we are increased risk of hypertension and also ischemic heart disease. So PCOS, or polycystic ovarian syndrome, leads to many things. Now, one would say, again, we talked about the etiology being somewhat unknown. So what can we do about this? What are some of the ways we can help ourselves, either from preventing PCOS or preventing the actual progression of PCOS? What are we to do? Because especially it can be troublesome in terms of some women, either you have an ovulation or you have pain during that time. Many women will tell you they actually will feel as if they're having their mens, but there is nothing. Okay, some women are very concerned, especially being at the childbearing age, and they're very concerned and wants to have a child. All right, so what are some of the things you think we can do? What are some of the things even persons have done? If you know anything, you can call in, you can share with us. What are some of the things either you have done? What are some of the things you know about? You can just share, send in your 2 pence. We're discussing here. Okay, feel free, don't be shy. All right, again, guys, you can message us via YouTube, Facebook, or you can WhatsApp us on 403-1031 as we discuss with each other the topic PCOS. Okay. All right. So as a physician, once a patient has presented with such presentations, for instance, with an ultrasound already showing the presence of 12 or more follicles on the ovary or bilateral sides, and also doing an hormonal test, and there's also presentation of your FSH to LH ratio being greater than 2, and it's actually your LH being greater than your FSH, right? And also with a presentation of an increased DHEA or androgens. Now, first things first, I honestly believe in preventative medicine. I definitely believe in lifestyle changes are sometimes the first thing that actually will play a great role in our health. So first things first. The main thing as pertaining to me as a physician, I would like to discuss with you as to your diet or what's happening at home. Now, what we have noticed as pertaining to PCOS, stress is one of the main indicators that would also stimulate or lead to PCOS. Now, it may seem somewhat strange, but as a result, stress causes what we will see hormonal imbalance. All right. Now, we have a question. Can PCOS be cured? Now, I don't want to go off and just said, oh, it can be cured. No, I'm not going to say that it can be cured. What I'm going to say is that the effects can be somewhat reversed if we work at it. Okay, so first things first, what's going on at home? What is your stress levels like? Now, this may seem as a topic just for women, but men, this is also a topic for you as well. Now, the thing is, in everything that we do in our daily life, stress does impact the body, and it affects the body in different ways. Now, if your stress levels are elevated, what happens is that you find what we will call a hormonal imbalance. Now, PCOS is definitely a hormonal imbalance because there is elevated LH and it shouldn't be, which is secreted from the pituitary. Whereas we want a nice balance of our FSH and our LH to actually form a nice mature Graafian follicle, which is going to release that mature ovum, and it's one at a time. That's why sometimes we get two. That's why we would get those, we get a twin or so, because sometimes there are actually two actual mature follicle that is released. That's great, right? We're not going to complain about that. But what we have with PCOS is that we only have that one mature follicle, or let's say it's not mature, but there are many follicles that are not mature as yet. One may rupture, but there's no egg, right? That is some of the issues that we're actually having with PCOS. Okay, so we want to focus on getting that stress level down, because it's the stress that actually would lead to hormonal imbalance. And remember, we're having what we call a haywire with our hormones, that is just secreting this increased LH, then this increased androgens, and then we have insulin on the other hand, that is also going to stimulate that ovary to release more and more androgens. All right, so stress is definitely something we definitely would like to attack. Okay, what is going on now? Based on our situations, not every situation can be changed immediately, but they can be addressed and things can be worked on. So we're going to look at, okay, diet. Now, to be honest with you guys, diet is very, very important. Okay, now some people say, okay, you can do strict diets where you remove all meats, but I would prefer to say you eat properly and healthy, and you eat in moderation. What I would like to add though is that you definitely stay away from processed foods. Now, many of the foods that can be processed, whether they have their chemicals, whatever they have, their agents, some of their preservatives to keep the foods, what happens is that some of these foods are seen sometimes as what we would say as foreign to the body. And as a result, they cause inflammation. So our actual immune cells, when they see some of these foods and some of their surface proteins, or they actually see these actual substances as foreign, and they are what we will call pro-inflammatory foods. So they cause inflammation in the body, and this leads to stress. So it adds stress on the body. So what I'm going to advise is that women that are having issues with PCOS is that you definitely try to eat foods that would prevent inflammation. Okay, so you definitely want to look into that. All right, so you want to decrease your processed meats, your red meat, you want to decrease on that as well. And remember, you're also decreasing anything that would lead to an increase in estrogen. Okay, for instance, anything that is going to increase fats like adipose, right? Your adipose tissues, you want to definitely decrease on your fat intake, because what happens is that these androgens that is from the that is released, whether from the adrenals or whether they're released from your ovaries, what happens is that they can be converted into estrogen in your fat tissues, and this again causes more problems, because the estrogen then will cause more fatty tissues to develop, and that's why we have most persons with PCOS will be obese, or they actually would have a bigger or greater BMI. Okay, I have someone that said recently a doctor suggested metformin to shrink the size of enlarged ovaries. Can you explain this a little bit more? Okay, so I'm just going to get into it a little bit more for you as pertaining to metformin. Now, I would just like to add that metformin is not actually the first line treatment for PCOS. Okay, now the truth of the matter is we are living in a very fast-paced society, and many people want things to be done very quickly. Now, what are some of the first line treatment for PCOS will be weight loss in most women. So that is why I'm actually getting to the diet first, so that we slowly start to, it's a lifestyle change. Some of these conditions are seen as, many of them, like for instance, diabetes type 2, they are so metabolic. our diet, our lifestyle, everything plays a role, right? So from the moment we start to change our diet and start to work on certain, like start to eat certain foods, guys, the vegetables, the fruits, right? Especially fruits that are seasonal. So especially again, sugars, we need to decrease on our sugar because remember there is an increase in insulin resistance. Now, I'm happy that this person asked this question. Another question I've had, or I've also seen patients who may not be obese and may not be overweight, but they present with PCOS. This also can somewhat follow a genetic line. Sometimes your mom could have had PCOS, your grandmother could have had PCOS, but they had children. But based on the society we're living in today, many of our foods are so processed, right? We're actually we're not eating as healthy as our foreparents used to eat before. So you actually would see more presentations of PCOS, even though your the generation before you actually had it, but was able to conceive. All right. So the first line treatment for polycystic ovarian syndrome will be weight loss. Now, some people will tell you that they have gone on drastic diets, whether they have removed meats completely, they have removed sugars completely, most of the sugars, no refined sugars. Most of the sugars they would take will be from their fruits. So whether seasonal, if mangoes are in season, they would just eat the mangoes give them the sugar. The papaya, the watermelon, whatever fruits that we have in season, those are the fruits that they are actually going to consume, because refined sugars, all of that, we want to decrease on our insulin resistance, and we want to increase insulin sensitivity. Also, exercise. Now, exercise can be very challenging for women living in this fast-paced world, but also, so if you cannot go to the gym, there are other things you can do. I always suggest the hiking. I always suggest swimming if you're a good swimmer. Zumba is really nice too. You also want to do aerobic activities or cardio. Sometimes just brisk walking can also help bring down that weight. But remember, it's also changing your diet, lifestyle change, along with exercise to actually decrease that weight. Okay. All right. So I'm just going to go into a little bit more for you with the metformin. Now, metformin has a specific function. Okay. So metformin is used to actually treat diabetes type 2. Because what metformin actually does is that it actually increases the insulin sensitivity on the tissues, allowing insulin to take up that glucose and actually puts it into the cells so that it can be used for energy. So that is the main thing, what the function of metformin, right? But metformin, it's actually trying to prevent, I would not say it's actually helping the actual cells, right, in actually producing an actual cell, but what it does, it helps with the insulin resistance. Okay, so when it actually prevents that insulin resistance, it's actually going to help decrease, right, it's going to decrease the actual secretion of androgens. Okay, because remember, the body has to secrete a lot of insulin in PCOS. Now, if you add insulin as your therapy, it's going to decrease the amount of insulin that is released by the body, and as a result, it leads to a decrease in androgens. So that is why insulin is definitely used as a drug for the regime of PCOS. Okay, so there are other medication you can also use as well. So yes, you see, it's somewhat indirect. So as a decrease in androgen definitely would decrease in the size of the ovaries, because remember, around that ovary will have what we call these Tika cells. Yeah, so Chantilly, right? So they have these Tika cells, and these Tika cells is what going to stimulate and release that androgen. So the more androgen, the bigger those cells would actually be, because it's actually stimulated by it. Yeah, so metformin basically would decrease that insulin resistance. Okay. Now, some persons would say, oh, doc, well, I've also heard about other drugs. So like clomiphene. All right. So what clomiphene is actually a hypothalamic estrogen receptor antagonist, and it's a second line pharmacological therapy that is commonly used for PCOS. So the clomiphene is basically used to increase ovulation. So this one does actually increase your chances of actually normal ovulation. So it increases your ovulation. Again, I want to just go back to my friend Marsha here that mentioned diet and intermittent fasting. All right. So remember on one of our episodes, we actually did mention intermittent fasting. So all of these are ways in which we are going to use these type of the intermittent fasting and the dieting again is to lose the weight. So guys, it is challenging among us as women. It is challenging, but we can do it. Again, it's good to have support. It's good to have persons with you. Men, you walk with your wives, take them to exercise, take them to walk, bring them to the gym, whatever. Okay, get involved. It's important for you to get involved, right? Then you wonder, okay, well, why? Or she's silent, she's not mentioning anything about that. But it's important that you guys get involved. Go to the gym together, go walk together, whatever, go hike together, swim together, be apart, okay? Because this definitely will actually decrease the stress level and would definitely help with weight loss. Okay, just to add, there are other medications as well that we can use, such as spironolactone. Now, these are basically they're added. Now, one of the most common ones that I did not mention, and I'd just like to go right back to it, would be our combined estrogen progesterone oral contraceptives, right? So these are the COCs. Now, these are the first line pharmacologic therapy for most women with PCOS who actually desire conception, right? So basically that's going to be many of those you can get all your OCPs. That's going to be your OCPs basically. Now, some persons will tell you, okay, doc, well, I've tried those and I'm not actually getting pregnant. So one of the most important thing you definitely want to focus on, as I said, yes, we have our first line drug of choice. Then we also have our clomiphene, which would definitely help with increasing ovulation. But guys, the main thing is that we must do an overall check. We must do an overall check on ourselves. So we definitely will want to have a lifestyle change. We would want to have diet change, weight loss, exercise. Now, in the diet, I just want to go in that area because I know it is very important, because you'll be like, well, what can I eat? Again, we want to stay away from any foods that's basically is in a package that is processed with many preservatives. You want to eat as healthy foods and most natural foods as possible. Family and friends, guys, husbands, when you go out to the grocery, you want to be able to purchase foods that are fresh, right? Natural foods. I actually had a patient that had a testimony. Her testimonial was using, I think it was CMOS. All right. So she actually has PCOS, and what she did, she actually started using CMOS as one of her actual daily tonic, I would say. And what she told me is that she noticed one, so she started just making smoothies. And she noticed, first of all, there was weight loss. Again, after maybe a month or two, then she got pregnant unexpectedly. So sometimes, again, as I said, yes, the drugs, yes, the medications, they also help. They play a role, definitely. But you have to it's all rounded. You have to make sure that you are dieting, you're eating properly, you're exercising. You also want to make sure that you're sleeping well. Now, if your body is very stressed, remember we said that stress causes hormonal imbalance. And as a result, that leads to that increase in androgens and all these abnormal concentrations of hormones. So you definitely want to reduce that stress with exercise or do things that you know would help reduce that tension. Right? And then slowly you can work with your physician as to a regime that works for you. So whether you want to do your oral contraceptives, if it's working, sometimes it's just to make sure that you have a balanced cycle. All right. And then if you think, okay, we can then move on to the clomiphene, right? And the clomiphene, which would then increase your chances of ovulation. But I strongly believe that your diet, your exercise, sleeping well at night, all of those play a role as well in maintaining a healthy life and also decreasing the severity of polycystic ovarian syndrome. All right, so I guess for now, I'm just going to leave the floor open to questions or persons who would like to ask any questions, as well as persons who would just like to share with us or some of their testimonials of where they may have had PCOS, what are some of the things they would have done to help reverse it, some of the things I would say are to manage it, right? Feel free, again, guys, you can WhatsApp us on 403-1031, or you can message via YouTube or Facebook. You are listening to Heavenly Medicine, and it's a pleasure being with you to share on PCOS this evening.
This is my song, I'm in the session, God. Only you know. Only you know how it feels inside.
Okay. All right. So I think for now this evening, I think we have come to somewhat a conclusion as to what polycystic ovarian syndrome is. Now, I'm also advising you, if you know that this might be an issue that you may have, I definitely advise you to see your general practitioner or your gynecologist so that they can definitely educate you a little bit more on the topic. They can guide you as to a proper regime as to how to manage your condition, and also as if considering contraception, what is the best route to go. So again, guys, I just want to thank you one and all for listening. Those of you that are tuning in, thank you for listening to Heavenly Medicine. Again, I'm your host, Dr. Zayniah Louison. It's a pleasure having you with us. I just want to say thank you, and a special thank you to the Sabazan family. I hope you all are doing well. I hope you are catching up and you're healthy. I also want to say a pleasant good night to all our friends, our family, those of you that are tuning in, those of you who would have sent your comments. Thank you for that. So that's it, I think, for us this evening. Have a blessed evening. Thank you once again. Good night.
'Cause if you don't, they won't see the morning. Oh, 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 oh. Only you know how she feels inside. These feelings she's trying to hide, that's for another girl. It's not supposed to be. Only you know she prayed and prayed, how much she is afraid to get the help she needs, that your blood can set her free. Oh, only you know he's going to church but losing hope, 'cause he's tired of repenting for the same things over and over. It's almost over for him. Only you know I'm surrounded by broken people, and they need a hero 'cause they can't fix what's wrong on the inside. Boys here in the city, doctor, can you heal her? I pray, 'cause if you don't, she's not gonna make it. Doctor, can you heal her? I pray, yeah, 'cause if you don't, come, no, doctor, can you heal them? I pray, yeah, 'cause if you don't, no, doctor, can you heal them? I pray, 'cause if you don't, oh, they're not gonna make it. Rapper, promise that you're the healer. Promise that you're the healer. By your stripes we are healed, 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 healer.
hard-headed representative